Sonia Jai Shri Krishna, Jai Chirendra, Jai Swami Narayan, Sairam, and good evening to everybody, and a very warm welcome to you all. On behalf of GAA London, I am delighted to welcome you to today's Community Health and Wellness webinar, looking after our health, understanding breast health and breast cancer. Thank you all for joining us this evening. We are pleased to bring our community together for such an important and meaningful topic. Breast health is something that affects many individuals and families, and yet it is not always spoken about openly. Today's session is an opportunity for us to learn, to raise awareness, and to feel more confident in recognizing signs and symptoms, understanding the importance of early detection, and knowing when and how to seek medical advice. The presentation will also cover NH exceptions and practical steps that may help reduce risk. We hope this session will help empower everyone with useful knowledge and encourage open, supportive conversations within our families and communities. So after the presentation, we will have an interactive Q&A sessions. So please feel free to note down any questions as we go along. So there is chat, use that. You may also post your questions in the chat as you want, and we will try to cover as many as possible. So before we begin, may I kindly request everyone to keep your microphones on mute during the presentation, unless invited to speak. This will help ensure the session runs smoothly for everyone. Once again, thank you for joining us, and thank you to our speaker for giving her time and expertise for this valuable health awareness session. I will now hand over to our speaker, Almona Chowdhury, to begin the presentation. She is a patient's advocate and philanthropist, public health spokesperson for breast cancer. Breast cancer now. All yours, Almona. Welcome to our team.
Thank you very much for inviting me. And we're going to spend 45 minutes me presenting what I need to say. So it will seem rather kind of monotonous in the sense that I'm speaking, but there will be some aspect of interaction. And at the very end, you are welcome to ask any questions. And I'm willing to stay beyond the 1 hour because I think it's important to field the questions. So if I may begin?
Yes, sure.
Yes. So as stated, my name is Almona Chowdhury, and I'm a breast cancer advocate, philanthropist, and a public health spokesperson for breast cancer now. And I'm here to speak about being breast aware and being breast conscious about the various symptoms that we need to look out for. The presentation will give you an overview of our vision, some of the key breast cancer statistics and facts, what it means to be breast aware, signs and symptoms, the NHS breast screening program, causes and risk factors, including ways to reduce your risk, and busting some common myths and misconceptions. And as I mentioned, there'll be time at the end to ask some questions. So if we can go to, we've done slide 1, slide 2. If we can go to slide 3, please, a third page.
Okay. Just give me a second. Share.
Perfect. That's page 1, and we've done page 2. And we're now on page 3. Perfect. Thank you very much.
Is that 3?
Yes, correct. That's perfect. So we are using materials from breast cancer now, and they're very keen to reach out to underserved communities. So, so slide 3 is Breast Cancer Now is the UK's leading breast cancer charity, providing life-changing support for all people who are affected by breast cancer. Breast Cancer Now's vision that by 2050, everyone who develops breast cancer will not only live, but be supported to live well. So it's an amazing pledge to have. Next slide, please. Next few slides explain what breast cancer is. Next slide, please. So breast cancer is the most common cancer in women in the UK. It's estimated that 1 in 7 women will develop breast cancer in their lifetime. Around 55,000 women are diagnosed with breast cancer each year in the UK. And although breast cancer is rare in men, nevertheless, 400 men are diagnosed each year. And another 7,000 women are diagnosed with early stage breast cancer, which is called ductal carcinoma in situ, also known as DCIS acronym, which is what I had. And you may hear DCIS described in different ways, such as pre-invasive, intraductal, non-invasive, in situ cancer, or stage 0 breast cancer. It's all very confusing designations. Most cases of DCIS are found during routine breast screening, as was in my case. So when you turn 50, you are invited to go for breast screening by the NHS. It is very important for you to accept and attend. So an estimated 900,000 people, mainly women, are living in the UK who've been diagnosed and living beyond breast cancer. Sadly, 11,500 women and 90 men die from breast cancer each year. And that's mainly due to late presentation. Overall, the number of people diagnosed with breast cancer is rising. This reflects the increase in life expectancy and the number of people diagnosed with breast cancer earlier due to being breast aware. Currently, the number of deaths from breast cancer is falling, and this is due to the number of factors such as early diagnosis, improved and newer treatments, and patients taking part in clinical trials where breast cancer can be picked up early. Next slide, please. These images here show how the breast is made up of various structures, each with its own unique function. Breasts are made up of lobules and ducts, which are surrounded by glandular, fibrous, and fatty tissue that gives the breast their size and shape. Lobules are glands that produce milk to feed the baby. Ducts are tubes that carry breast milk to the nipple, ready for breastfeeding. The structure of the lobes and ducts is a bit like the branches of a tree. When checking your breasts, these are the structures you often feel. It's important to highlight that breast tissue is found in the breast and the upper part of the chest and under the armpits. So it's not just where traditionally you feel where the breasts are, but in your upper part of your chest as well as the armpits. The nipple is surrounded by a darker area of skin called the areola. On the areola, there are some small raised bumps which produce fluid to moisturize the nipple. Breasts contain a network of thin tubes called lymph vessels. These are connected to the lymph nodes under the arm. Breast cancer can spread to other areas of the body through this lymphatic system or the blood vessels. Next slide, please. Slide 7. Cells normally multiply in a regular, orderly fashion, but sometimes they change and begin to grow and divide in an abnormal, uncontrolled manner. Breast cancer is a term used for all cancers that start in the breast tissue and occurs when cells in the breast begin to divide and grow abnormally and uncontrollably. Breast cancer is not one single disease. There are several different types. Breast cancer can be non-invasive, that's DCIS that I referred to before, or invasive. These different types of breast cancer can be diagnosed at different stages and can grow at different rates. This means people will have different treatments depending on what will work best for them. Non-invasive or DCIS cancer is essentially early breast cancer, only found in the milk ducts or lobules of the breast, that has not developed the ability to spread within the breast or to another part of the body. This was my case. And I have to, sorry, I didn't say that at the beginning that I was diagnosed with early stage breast cancer in October 2022, and I was successfully treated in 2023. Primary or invasive breast cancer is breast cancer that is spread to surrounding breast tissue or lymph nodes, but hasn't spread beyond. Most breast cancers are invasive. Invasive breast cancer has the potential to spread to other parts of the body, but this doesn't mean the cancer has or will spread, just that it has the possibility, the potential. Metastatic or secondary breast cancer occurs when breast cancer cells spread from the breast to other parts of the body. This may happen through the lymphatic system or the blood vessels and can spread to bone, liver, lung, and brain. Sadly, this is incurable. You may also hear secondary breast cancer referred to as advanced breast cancer, secondary tumors, or stage 4 breast cancer. But there are many who live for several years, beyond 12 years, even though they've been diagnosed with stage 4 breast cancer. Next slide, please. Being breast aware means getting to know how your breasts look and feel so you know what's normal for you. Nobody knows your breasts better than you. It's also about having the confidence to recognize what new or unusual changes to look out for and feel for. It's worth remembering that breast cancer changes occur throughout your life. They happen through puberty, the menstrual cycle, pregnancy, and the menopause. Next slide, please. In fact, if we can keep there, if we can go back to the earlier slide. Perfect, thank you very much. So breast cancer now has developed a breast cancer message, breast cancer awareness message called Touch, Look, Check, TLC, something we can remember quite easily. It's been developed to give people a clear, simple message to encourage them to check their breasts, as well as information about the signs and symptoms of breast cancer. Breast checking is simple as TLC, touch, look, check. It's important to get into the habit of breast checking and to contact your GP if you notice any new or unusual changes. But also, if you're unsure what to look out for, don't hesitate to phone your GP practice and make an appointment with the nurse to perhaps support you in checking to see what, perhaps there may be something new or perhaps not. But it's best to be, I think, safe than sorry, as it were. Checking your breasts only takes a few minutes and you don't need to feel your breasts in any particular way. If you check them as part of your usual routine, you won't need to worry about whether you're doing it often enough. Everyone has their own way of touching and looking for change, so decide what you're comfortable with and what works best for you. A good time to do this might be when you're in the bath or shower, using body lotion or getting dressed. It's about finding a time and place that suits you. Get used to touching, looking and checking your breasts. And remember, if you notice a new or unusual change, it's important to contact your GP as soon as possible. They are keen for you to contact them, as it saves the NHS thousands, if not millions of pounds when diseases or issues are checked early or diagnosed early. Next slide, please. As I mentioned before, breast cancer is the most common cancer in women in the UK, so early detection is vital. The sooner breast cancer is found, the more successful treatment is likely to be. Most cases are often found by people noticing unusual changes themselves. So who should be breast aware? Breast cancer can affect anyone, regardless of age, gender, or ethnicity. So we recommend all adults should be breast aware. Even though breast cancer is rare in men, we recommend that men should be body aware, something language that's more palatable for men, perhaps. We also know that breast cancer is more common in white women and women from more affluent backgrounds. Also, Black, Asian, and minority ethnic women and those from less affluent backgrounds are less aware of signs and symptoms, are less likely to check their breasts, and are more likely, sadly, to present later when treatment options are limited and outcomes are poorer. So it's important we encourage everyone to get into the habit of regularly checking their breasts. Next slide, please. The signs and symptoms that I'm about to mention don't necessarily mean you have breast cancer, as there are many other benign conditions that are not breast cancer but have similar signs and symptoms. What's important is to get used to anything unusual being checked out sooner than later. Can anyone tell me some of the symptoms and signs of breast cancer? I'm not sure whether your viewers are allowed to perhaps engage at the moment.
Yes, they are.
Perfect. So can anyone tell me any signs and symptoms that they need to look out for breast cancer?
Pravinaji, you're muted. Unmute, please.
Actually, when you check your breasts and you find lumps of some sort, you've got to make sure that you run to the GP, because I did. In 2023, I saw a little lump on my right breast, the size of a marble. And thank God I did. And I was told, yes, it's the first stage of cancer. And fortunately, it was removed. I didn't have any therapies because I didn't need it. It hadn't gone any further. The lymph nodes were also very clear. So, yes, checking the breast. I told everybody in G&A, as soon as I came back, I told everyone, please make sure you check, because I'm a loudmouth. I like people to know they don't get into trouble. Once these things happen to you, you need to really make everyone aware of it. And I hope I did. Thank you.
Bless you. Continue your loud mouth. Being outspoken is important.
Yes.
When you repeat things, it does kind of remain in one's consciousness to do your bidding, perhaps. But well done. Yes, lump is one. Is there anyone else who can perhaps suggest any signs and symptoms?
Can I say something?
Yes, of course.
I had breast cancer 15 years ago, and I went for my first mammogram, and from there they found out cancer cells. It hadn't developed into a tumor or anything, but they caught it straight away, and I went through some of the treatments as well after the surgery, but it has come back after 15 years.
Oh my God.
And luckily for me, that in the first mammogram, when they looked at it, they couldn't find anything. They said that there's nothing they could find. But after a while, I said that no, the shape of the breast has it's different. So I was called in again. They did the mammogram. Still, they couldn't find anything. Till I insisted that please could you do the biopsy under my scars, and from there they detected this cancer. They found some cancer cells. And at the moment, I'm going through some treatments. Well, this is what I think everyone should check. Even though you've had your first surgeries, please do keep checking and look at the sizes of your breast as well.
Brilliant. Well, thank you very much. I'm sorry to hear, but very good message. Thank you very much. It is a constant aspect of being aware of your body. We are experts of our own body, mind and soul. So, and do question your clinicians if you're not happy about what they're saying or what their lack of diagnosis, as you've done, Pragna. Insist. It's very important. Anyone else wishes to say anything? That's fine, not to worry. We need to kind of move on as well. So lump and swelling, thank you very much for that. Change to skin is another sign symptom. Change to color, nipple change, rash crusting around the nipple, unusual liquid discharge, change to shape or size. So it's not just the traditional lump that we should be looking out for, but anything that's different to how it is for you. In my case, apparently there was a lump, but I couldn't feel it. And it was only through a routine breast screening, because I had turned 50 previously, that the cancer was diagnosed. And in fact, what happened is that the ICE team, not a very good connotation here, but the ICE team of the NHS kind of take over, and they bypass the doctor's surgery and call you in to double check. And that's where I was kind of signaled to get treatment immediately without any delay. And another sign and symptom is pain. So pain in itself doesn't necessarily suggest that you have cancer or any disease, but it's something to look out for in conjunction with other signs and symptoms. Next slide, please. Yes. So remember, when feeling your breast, check all parts of your breast, your armpits and up to your collarbone. No matter what size or shape your breasts are, check them regularly, or whenever you can remember. We don't want this to be a task. We have so much on our plate, particularly when we're mothers, grandmothers, that we're thinking, oh my goodness, another extra burden on our plate. But just whenever you remember, when you're perhaps getting dressed or applying body lotion, getting a shower, a bath, just check, and don't be shy. This is just a body part that needs to be looked at. And if you're well, of course, you're able to take care of others. That typically, as mainly as women, perhaps, and men too, that we're nurturers and we want to make sure others are taken care of. But we must take care of ourselves first. Next slide, please. So can you feel a lump or swelling in the breast, upper chest or armpit? So remember, not just the breast, the upper chest or armpit. You might feel a lump, but not see it. Lumps can be small or large, hard or soft, painful or non-painful, round or a different shape, and should be reported to the GP without delay. And as a previous viewer mentioned, her lump was the size of a marble, but you can be in other shape and sizes and also feel different to the touch. Next slide, please. Is there any change to the skin, such as puckering or dimpling of the skin of the breast? Next slide, please. Can you see a change in the color of the breast? The breast may look darker, red, or inflamed. Next slide, please. Do either of your nipples, look different? For example, one of them might become pulled or inverted, meaning turned in, when it normally is turned out. Some women are born with inverted nipples, which is normal. Slide 17. Sorry, next slide, yes. So can you see a rash or crusting of the nipple or the surrounding area? Next slide, please. Have you noticed any unusual discharge from either of your nipples? Next slide, please. Can you see any change in size or shape? For example, one breast might become larger or lower than the other. It's very common to notice changes in the size of your breasts, especially if you are still having your periods. So it's a good idea to check your breasts at different times of the month. It's also normal to have one breast slightly larger than the other. So don't forget, our bodies aren't perfect. And in fact, we're quite asymmetrical. And there is a saying that there's beauty in imperfection. So please don't feel that the right or left breast have to mirror the other. It's perfectly fine to have both breasts looking quite different. Next slide, please. Breast pain is very common in women of all ages. Breast pain can happen through various stages of life, such as puberty, the menstrual cycle, pregnancy, and the menopause. Breast pain can be distressing, and many women worry they may have breast cancer. But on its own, pain in the breasts isn't usually a sign of breast cancer. In most cases, breast pain will be the result of normal changes in the breasts. Next slide, please. Just to remind you, if you have any questions, you will have plenty of opportunity at the end to ask. Next slide. Perfect. So many people don't know that men can get breast cancer because they don't think men have breasts, but men do have a small amount of breast tissue. Breast cancer in men starts in a small amount of breast tissue. It's very uncommon. Around 400 men each year in the UK are diagnosed with breast cancer. Most men get breast cancer when they are over the age of 60, although younger men can be affected too, and increasingly so, in fact. The most common symptom in men is a lump in the chest area, which is often painless. Other symptoms in men may include liquid discharge that comes from the nipple without squeezing and which may look blood-stained, a tender or inverted that is pulled in nipple, ulcers or sores in the chest or nipple area, swelling of the chest area, and occasionally the lymph node in the armpits. The exact causes of breast cancer in men are not fully understood yet, but certain things increase the risk. One piece of research that Breast Cancer Now have funded is the Male Breast Cancer Study, which looks at what might cause breast cancer in men. and a link to that of the same wordings can be found on the Breast Cancer Now website. Next slide, please. This information refers to the routine NHS breast screening program that is available throughout the United Kingdom. Next slide, please. Breast screening prevents an estimated 1,300 deaths from breast cancer each year in the UK. Here are 5 things to know about breast screening. 1, you need to be registered as a female with your GP to be automatically invited for screening. Once you turn 50, you'll be invited for screening every 3 years until your 71st birthday. It might not happen, that's the invitation, might not happen the year you turn 50, but it will be by the time you're 53, as was the case for me. Routine screening uses a breast X-ray known as a mammogram to look for breast cancer that may be too small to see or feel. Mammograms are the most reliable way of detecting breast cancer sooner. Your mammogram will be carried out by a woman in privacy and in confidence. After you turn 71, you won't automatically be invited for screening, so remember to book your own mammogram appointment after you turn 71 if you feel inclined to do so. It's not essential. Remember to always stay breast aware between mammograms, and for men to stay body aware generally. Next slide, please. Many different things. The next slides will focus on some of the known causes and risk factors associated with developing breast cancer. Next slide, please. Many different things affect your risk of getting breast cancer, including some things you cannot control. There's no single cause, and it results from a combination of the way we live our lives, our genes, and our environment. We can't predict who will get breast cancer, and we can't confidently say what might have caused someone's breast cancer. Aging is the most significant risk for developing breast cancer, as with other diseases. 8 out of every 10 cases are diagnosed in women over the age of 50. Around 2,300 are diagnosed age 39 or under. So it's important all adults are breast aware. So young adults should develop a habit of being breast aware, so they get into their kind of routine of breast checking, and boys as well in terms of body check. Being female, over 99% of new cases are in women. Family history. A small number of people have an increased risk of breast cancer because of family history. However, most breast cancers are not inherited and do not increase the lifetime risk for other family members. People who have an inherited gene, an altered gene, however, will be at high risk of developing breast cancer and possibly other cancers too. Around 5% of women with breast cancer carry this gene. However, breast cancer is the most common cancer amongst the UK. So even if you have a relative with breast cancer, it doesn't necessarily mean you're more likely to develop it yourself. Next slide, please. There are other risk factors that women are often worried about that can increase the risk of breast cancer, or developing it, I should say. For most people, the risk of developing breast cancer because of taking HRT is small, with every 2 in 100 breast cancers in the UK thought to be linked to HRT. That's hormone replacement therapy. It's not fully understood why HRT increases the risk of breast cancer, but research suggests it's due to the higher levels of estrogen, which some breast cancers use to help them grow. There are 2 factors that influence the risk of breast cancer. First is how long you've been taking HRT. The risk is higher if you take HRT for over 5 years or started taking HRT at an older age, that's 50 plus, when breast cancer risk increases naturally. And secondly, the type of HRT you're taking. Breast cancer risk is greater with combined HRT, which contains both estrogen and progesterone. Those are both hormones, than with estrogen-only HRT. However, the increased risk reduces over time after you stop taking HRT. For many women, the benefits of taking HRT far outweighs the risks. Next slide, please. Both the combined pill and progesterone-only pill slightly increase the risk of breast cancer, but this risk is very small, and less than 1 in 100 breast cancer cases in the UK are thought to be linked to the pill. Also, the increased risk of breast cancer reduces when you stop taking the pill and disappears within a few years. Your exact level of risk will depend on other factors, including your age. Breast cancer is rare in young women who are more likely to take the pill anyway. The pill is a safe and effective method of contraception, and for many women, the benefits of taking the pill outweigh the risks. If you're worried about breast cancer and the pill, or unsure what type of contraception you should take, then please speak to your GP or the family planning clinic. Next slide, please. While there are risk factors out of our control, such as age, gender, and our genes, there are some things that you can do to help lower your chances of developing breast cancer. It's currently estimated that around 23% of breast cancer cases is preventable and are related to lifestyle behaviors, including being overweight or obese, alcohol consumption, and physical inactivity. By making small changes to our lifestyle and living well now, you can lower your chances of getting breast cancer and other diseases, in fact. It doesn't guarantee that you won't develop breast cancer, but leading a healthy lifestyle gives you a far better chance. It's also beneficial in reducing the risk of other diseases such as diabetes, cardiovascular diseases, asthma, and of course improves your mental well-being. Next slide, please. You can reduce your risk of breast cancer by being physically active on a regular basis. You can benefit from any activity that makes you breathe harder and gets you warmer while still letting you carry on a conversation. Aim for at least 150 minutes a week. That's the NHS recommendation. You can divide this up, so it could be 20 minutes a day or 30 minutes 5 days a week. Any amount of activity is beneficial, but more is better. Exercise such as swimming, fast-paced walking, cycling, playing sport are ways of staying active. You'll be pleased to hear that some everyday activities also count, such as taking the stairs, gardening, or housework, as long as they make you breathe harder and you feel warmer. So all these activities count towards your 150 minutes per week activity. Breast cancer now is helping people to get active. We're one of 16 charities supporting a campaign called We Are Undefeatable. This movement supports people with a range of long-term conditions to be physically active. You can access many tools and resources such as videos about physical activity, as well as tips on how to get started. So head over to the website, which is www.weareundefeatable, all one word, no space, .co.uk. It's a very helpful site. Next slide, please. Keeping to a healthy weight can lower your risk of getting breast cancer. Your risk of breast cancer increases if you're overweight or living with obesity after the menopause. And the more weight you gain during adulthood, the higher your risk of breast cancer later in life. As a guide, healthy weight is having a body mass index, or BMI for short, between 18.5 to 25 kg per square milligram for white population groups. Healthy BMI is lower for some ethnically diverse groups, including those from Black and Asian backgrounds. For these groups, it's at 23 and lower. And if you want to calculate your BMI, what you would do is measure your weight in kilograms, times it by your height in meters, and square that, and so that your weight on top and your height below, and that should equal your BMI. So mine works out to be perhaps not so much now. I was 57 kg a few months ago, and I divide by 1.6 my height in meters squared, and that's equal to overall 22.3 kg per milligram. So that's the way to find out your BMI. I'm sure you're all aware of that. So eat a balanced and varied rich diet in fruit, vegetables, pulses and whole grains, and low in red meat and processed meat, fatty foods and sugary foods. So it's helpful to kind of remember that South Asian diet foodstuffs are very excellent. And if you think of the range of colors in vegetables and range of colors in fruit, then you can't go wrong. So try to avoid processed food as much as you can, and certainly avoid ultra-processed food. Next slide, please. Drinking alcohol regularly and excessively increases your risk of developing breast cancer, with around 8 out of every 100 breast cancers thought to be linked to drinking alcohol. Even if you don't drink, you still have a risk of developing breast cancer. The more alcohol you drink, the greater the risk, but even one alcoholic drink a day increases your risk of no level of drinking. It increases your risk, and no level of drinking is completely safe. If you're going to drink, national health guidelines across the UK recommend you don't drink more than 14 units of alcohol a week, spread across 3 days or more. So 14 units, this may not apply to you, but it's good to know. 14 units is equivalent to 6 medium glasses of wine, which is equivalent to 6 pints of average strength of beer, which is equivalent to 12 single shots of spirit, that's vodka, gin, whiskey. So reducing the amount of alcohol you drink can also improve your general health and well-being and help reduce your risk of other cancers and diseases. We don't fully understand why drinking alcohol increases breast cancer risk. It may be because alcohol gets broken down by the body into chemicals that can damage our cells. Drinking alcohol can change the level of hormones in the body, including estrogen, which is known to help some breast cancers grow. The type of alcohol drink makes no difference to your risk. It's the alcohol itself and the overall amount you drink that matters. Next slide, please. There are many myths and misconceptions about the cause of breast cancer, which can cause confusion and concern. Next slide, please. So another little interaction here. Does anyone know which of these increases the risk of breast cancer? Please don't be shy. Even if you hazard a guess, please do speak.
Chemicals in the environment?
Thank you. I shall answer that question later, but please do fire away with any other aspects that you think.
Stress.
Okay. Any more?
Mobile phones.
Interesting. Any more? Perhaps
Nipple piercing.
okay. Any more?
Underwire bras.
Okay.
Deodorant.
Okay.
Maybe breast injury.
Okay.
Mobile phones.
Okay. Any more?
Chemicals in the environment.
Can you repeat that? Sorry.
Chemicals in the environment.
Perfect. Yes. And even if they're not listed up on the screen, are there any more that you suspect may cause the increased risk? That's fine. Not to worry. So you'll be perhaps pleased to hear that none of those that's printed on the screen now or posted up on the screen, they do not increase your risk of breast cancer. There's no evidence of it. So Breast Cancer Now is a research organization, and they will only make mention of things that are evidence-based. So that's reassuring. So underwire bras, they may be uncomfortable, but they don't increase your risk. And using deodorant or antiperspirant does not cause breast cancer. Claims that it does have been around for several years. Some people have also claimed that aluminium in antiperspirants can increase your risk. There's no convincing evidence of a link between breast cancer and deodorants, antiperspirants, or their ingredients. Do underwire bras cause breast cancer? They do not. There have been some concerns that the wires in the cup of underwire bras may restrict the flow of lymph fluid in the breast, causing toxins to build up in the area. However, there's no reliable evidence to support this. If your bra is too tight or too small, the wires can dig into your breasts and cause discomfort, pain, or swelling. I, in fact, don't wear underwire bras, and I haven't been even prior to my diagnosis because I feel it's so very uncomfortable. But perhaps when you're young, you want to kind of look fashionable, which you can do, of course. It's according to your kind of comfort. Does stress cause cancer? There's no conclusive evidence. A number of students have looked at the links between stress and breast cancer, but there isn't enough evidence to show a clear association. Stress can be linked to a rise in our other lifestyle behaviors, such as being less active or drinking alcohol, which could, in combination, increase your risk of breast cancer. Research is ongoing about nipple piercing causing breast cancer. Nipple piercings have become a popular trend, but there's currently no evidence that having pierced nipples increases the likelihood of developing breast cancer. However, the area pierced is at risk of infection, and as long as you wear the jewelry, the risk of infection persists. Mobile phones, can they cause breast cancer or increase the risk of? There's no evidence that radiation from mobile phones has any effect on your risk of developing breast cancer. Some people worry that radio waves produced and received by mobile phones may be a health risk, especially if they keep their phones in their breast pocket. However, there's currently no evidence that radio waves from mobile phones causes breast cancer or increase the risk of developing it. Can IVF cause breast cancer? That's in vitro fertilization. What we used to term as test tube fertilization. There's no evidence to suggest IVF treatment affects your risk of breast cancer. Current evidence suggests women who have received IVF treatment are no more likely to develop breast cancer than women who have not had IVF. However, IVF is a relatively new procedure and more research is needed to be sure of all the long-term health effects. Research by its very nature takes years to be accurate and to be published. Does abortion increase the risk of breast cancer? Having an abortion does not affect your risk of developing breast cancer. Some previous research on abortion suggested it might do so, but several well-designed studies from recent years have shown this is not the case. Can chemicals in the environment cause breast cancer? There's no conclusive evidence that exposure to chemicals in the environment increase your risk of breast cancer. Lots of studies have looked at the relationship between breast cancer and chemicals in the environment, such as pesticides, traffic fumes, and plastics, but there's no clear evidence of any links. It can be very difficult to work out the effects of individual chemicals when we're exposed to low levels of thousands of chemicals during our lifetime. Some studies have suggested that women who are exposed to chemicals in their job, for example, in the manufacturing industry, may be at higher risk of breast cancer, but the evidence is weak and more research is needed. Employers, in any event, are legally required to limit exposure to chemicals that may cause cancer. I hope this answers all your concerns. Next slide, please. And don't forget, you can ask questions at the end. Oh, sorry, but I did mean to say, can we go back to the prior slide, please? Sorry. Can working night shifts cause breast cancer? Although it was previously thought working night shifts may increase breast cancer risk, the latest research has found people who work night shifts are no risk of, or greater risk of being diagnosed with breast cancer. This is the case regardless of the type of work and the age someone starts night shifts. So that should be reassuring to many. Next slide, please. So for more information, please visit the Breast Cancer Now website. They've got a fabulous helpline where you can speak to specialist nurses that can answer your questions in confidence. You may not feel comfortable asking family or friends, so give that number a call. It's important. And any questions that you may have and areas that I haven't covered, just call that number. They're there to answer all your questions and your concerns. And it's best for us not to have any concerns so that we can be freed up. And concerns itself can cause stress, so we want to be averted from that. And then you've got the email address there and all the various other details that you may need. Next slide, please. And if you wish to get involved, like I have several roles with breast cancer now, in fact. So I'm not just their public health spokesperson, but I'm also a local representative. I'm also a Service Pledge volunteer, and I get involved in various research studies and clinical studies that links that are shared with us. We don't have to be involved with every aspect, but we can pick and choose. So, for example, I focus on the public health spokes aspect, presentations, and then I dip in and out of the other volunteer aspects. So please do look at the website and see what perhaps suits your itinerary and suits your wish and your skill set. Next slide, please. So your feedback is very important in terms of what you thought of this presentation, but perhaps you'd like to give feedback to this organization rather than Breast Cancer Now. So thank you very much for your time and energy for being here. So I'm open for any questions that you may have, and I'm not sure whether you could perhaps look at the chat to read out some questions that are in there, please, if any. And please feel free to come online to ask any questions or questions in general that you may have.
So there is one saying, I have just gone through, oops, it moved. Sorry, it moved. Hold on. I think the questions are coming in now. So.
Those who wish to ask in person.
Okay, it's saying that I have just gone through mastectomy as a result of lobular invasive cancer grade 2 weeks ago. This was due to my mammogram at the age of 70 years. And she continues, but I think she's not finished, saying, Lucky I went for mammogram, therefore it was real fast track in Southampton. I hope the government increases the age limit and not stop at age of 70.
Yes, I just to remind you that yes, sadly it does stop at the age of 71, but you can elect to continue being breast screened. So you need to be proactive in relation to that. So please remember that you can ask to be invited for breast screening beyond the age of 71. So absolutely, mammogram is the way that most breast cancers are diagnosed, and thankfully we have that system in this country. And I'm sorry to hear about the mastectomy. I, in fact, had mastectomy and reconstruction of my right breast. And yes, so we're given a second lease of life. And the most important thing going forward is lifestyle factors. So please, regular concerted exercise, if it's a brisk walk, gardening, housework, it all counts. Even cooking, when you're chopping those vegetables, a lot of energy goes into, any aspect of movement. Just whenever you remember, just go for that walk. It can be an impromptu walk, be active. Diet is very important as well. So try to avoid greasy foods, but all our amazing vegetables that we have, South Asian vegetables, fruit are incredible. Keep away from red meat on a regular basis. Fish is good, and vegetables, of course, you cannot go wrong with. And the third pillar that I, in fact, follow, so it's exercise, diet. The third pillar, particularly as women, that we really need to be mindful of is self-love. Do things that you want to do. Do a hobby. Buy yourself something. And do something that you want to do and not be led by others. Because when we feel happy, when we feel accomplished, when we've chosen something that we want to do, then it really does impact us emotionally, and we're happier. So happy mum, happy grandma, happy rest of family. Sorry, next question.
There is Nalini ji. What's your question?
Hi, thank you. Thank you, Almona, for this really informative session. It's been really good. Earlier you mentioned about going to get advice quickly, but given the state of our appointment systems at the moment, how long would you say, if you haven't been able to get an appointment with the GP, would you go somewhere else, or like to the walk-in centre or to A&E?
Well, it's the fascinating thing is that we are resorting, aren't we, to the A&E? I have myself for other aspects. I wouldn't hesitate because that does push them to perhaps gain an earlier appointment. I'll do whatever it takes. And sadly, increasingly, and I resorted myself to private treatment because the earlier the better. But for sure, go to A&E. If that's the only recourse that you have, just go there. Just say, I'm sorry, but I'm really concerned. I can't get an appointment with my GP. Can a nurse please show me what I need to look out for? So absolutely spot on. Well done for raising this. I wouldn't hesitate. We pay our taxes, and part of that is for the NHS. And the NHS at the end of the day is in fact looking for us to be proactive. So the earlier the detection, they save millions, so that do that. Don't hesitate. Don't be shy. So whenever you can, absolutely. I mean, the ND is open all the time, so just go in. Don't hesitate. Well done for raising this. Thank you.
Thank you. Thanks for all you do as well.
Bless you. It's my pleasure.
Thank you. Ravinaji?
Yes, actually, when I found my lump, I actually walked into the surgery and I went to the counter and I told the lady very quietly, very coolly, I need to see a GP very, very quickly because I have just found a lump. And straight away, within 2 hours, I got an appointment. So I think it's up to us to make that. Another thing was, I've just been to my mammogram today and I'm 76. I suppose because I had breast cancer, I get called every year. So this was my third one. So I'm happy they call us.
Yes, you would be automatically asked if you've been diagnosed with breast cancer.
Yes.
Irrespective of whether you haven't or you have, do please be proactive. And like you say, go to your GP surgery and make the ask. They will support you and help you. They won't turn you away. And if they do, then be persistent.
Yes, the third thing I wanted to ask was, is smoking another cause of breast cancer? Because I lost my sister. She had lived with the family, and I do not wish to name them, but she had a very aggressive first cancer, which was, she was told it will be all right, and she was on medication, and then within 3 years, she got the other one, and it just took her. And because we all come from a very healthy family with no issues, it was very devastating. So I thought maybe smoking has been the cause for cancer.
It's a very good point you raise, because smoking hasn't been listed in that slide. Because smoking is related to lung cancer, and it doesn't necessarily suggest that you will get breast from it.
But she ended up with lung cancer with the breast. And that was very sad.
Yes, very. I mean, alcohol, excessive alcohol, smoking, it leads to all sorts. And
she didn't smoke. It's passive smoking.
Exactly. I mean, it's incredible. I agree with you. I am so kind of impatient with those who smoke, even this, whatever you call it, they smoke with, I forget now what you call it now, using this contraption these days. I avoid it like the plague because it is so unhealthy. And I'm looking forward to the government banning smoking.
Yes. Completely.
Very much so. But you're looking very well, I have to say, your skin and everything.
Thank you.
And how are you feeling?
Thank you, Pravinaji. There's Reena. Reena, you want to ask?
Hi, good evening.
Reena?
Thank you for this. Hello, thank you for letting me in. Regarding to the GP, as I've worked, I know that the GP prioritize anything like that, a lump or anything. If you obviously go online and say it, or even if you call, they do prioritize patient with immediately and in 2 weeks wait, they will refer you for breast clinic for any mammogram or X-rays or MRI. Just wanted to say that. And it's a lovely chat. Lovely listening to you.
Fantastic. Thank you very much for raising this.
Thank you.
Thank you.
Anybody else who would like to say anything? No? I have a. Thank you so much for an informative and important presentation. I have a
Thank
few
you.
questions.
Thank you.
For people, I know you've gone through this. I know you've gone through this, but for people who are not sure what is normal for them and how often should they check their breasts and what is the best way to do this, would you care to explain that?
Yes, as I mentioned during the presentation, that traditionally, especially for my generation, so I'm 61, we were always asked to look out for a lump. But it's not just having a lump, and perhaps we won't be able to feel it like I didn't feel my lump, but apparently it was there. It's any changes to your breast tissue. Now, I remember breast is not just where our breast tissue, it's not just where our breasts are, but also the upper part of our chest and under our armpits. Anything that you see that's different, that you're curious about, that you're unsure of, I would make an appointment to see your GP or a nurse at your GP practice. Anything. If you're concerned, if you're unsure, that's key. Even if nothing comes of it, it's best to be safe than sorry. And if you're uncertain about something, you always have it in the back of your mind, and which causes concern. So do away with your concern, make an appointment with your GP and have it checked out. And if any changes, like I mentioned about the nipple, change to the color, crusting, unusual discharge, not a discernible lump, anything, maybe the breast looks different, or one of the breasts looks different, perhaps pain. So a singular sign or symptom may not mean that you have any disease, including breast cancer, but in conjunction with others, but always get it checked out. And also, so it's a very good question, in fact, that I had excessive hair loss, floaters across my eyes, and excessive tiredness by 2-3 o'clock in the afternoon, that I had to get rest for 1 hour to see through the day. So armed with these 3 symptoms, I went to my GP practice and they took a urine test. And when they hauled me back the following week, there was blood in my urine. Despite 4 symptoms of a bad disease, sadly, my GP practice shooed me away, suggesting it was to do with aging. And that was in 2019. So if I'm 61 now, I was in my early 50s, I think 54 then. I wasn't happy with that comment, but I had to accept it. And so in 2022, when I had my routine breast screening, they mentioned at that stage that back in 2019, when I had my last mammogram, that the cancer existed. But because I have dense breasts, my cancer was hidden. So I haven't mentioned dense breasts in this presentation, but I'm hoping that I get invited back because I do want to speak about dense breasts. So that if you're unsure and if you're uncomfortable with what's being said by any clinician, whatever their designation is, be they the GP, the nurse, or a consultant, always seek a second opinion. That's my very strong advice. We are the experts of our mind, body, and soul. So please seek a second opinion. And don't stress yourself. Just check whenever you remember. Now, I have been diagnosed with breast cancer, but I don't check regularly, but I check whenever I remember. We all lead busy lives, and we don't want to be kind of inundated with stuff. So whenever you remember, in the shower, when you're applying body lotion, when you're getting changed, just have a quick look and look in the mirror as well. That's a very good way of self-check. Thank you.
When you lose the hair, does it come back in fact soon or not?
Yeah, it's a very good question. I'm kind of losing hair again. I think that's to do with the medication that I'm taking. So that's the other thing. Different medication have different side effects, and certain medications don't suit us. So always go back to your consultant and say that this is not agreeing with me. Can I go on to another? It does grow back, absolutely. And that's to do with our lifestyle. So as I mentioned again, nutrition, regular exercise, and self-love. Those are the 3 pillars, that I follow. And I think we should all follow, particularly as women, to take care of ourselves. Absolutely, they grow back, yes. So please be assured that they do. And the other alternative is that if aging obviously results in thinning of hair, there are amazing wigs out there, I have to say. I haven't tried it myself, but there are wigs out there, so that, or perhaps, I forget now what you call them, wigs that you can attach to your normal hair. So there's always ways and means of feeling good as a woman. That's very important. It's not being vain. It's about how you feel about yourself.
I suppose that encourages others, to make themselves look good.
I think it's important, isn't it? It's not a question of being vain. When we when we look good, we feel good.
Yes, absolutely. Now, many people feel nervous or embarrassed about discussing breast changes. How can we encourage women in our community to come forward early and not delay seeking advice?
Yes, we have a habit across all society to sexualize our body parts. We should just think like a doctor would do, like a consultant would do. It's part of our anatomy in our body, that we should just treat it as such. And like we do, if we have a broken leg or an injury to our leg or arm, what have you, an appendage, we check it out. So think of it as an appendage in our body, and treat it as a medical individual would, and don't be embarrassed by it, because early detection is key. And sadly, diagnoses are taking place at an earlier age, so we need to all be aware of being breast aware, and for the male population being body aware. And it's not just in the United Kingdom, it's now everywhere. So 1 in 2 of us will be diagnosed with cancer in our lifetime. So breast cancer is just one of them.
Okay. So, are there any common myths about breast cancer that you can often hear about, especially in South Asian communities?
When you say meet, you mean get together?
Yeah. Well, as they're saying there, like, say my mom had breast cancer, and she did not tell me anything, but is there any particular thing that I should pick up from her? And then eventually, obviously, I've been chased about to look after myself as well.
Yes. Sadly, cancer is a kind of a dirty word.
There is a myth there, which I can't pick that up.
Yeah, so cancer is a dirty word, a dangerous word, a word we avoid using. And I get it, because I did the same. Even after my father's diagnosis, I resorted back to not wanting to discuss it or not wishing to. To me, it was irrelevant. None of us was diagnosed. And then when I was diagnosed, I kind of have done my research, and I've become a patient advocate and giving these presentations. And breast cancer now have done research. And sadly, in not just the South Asian community, but in many communities, it does remain hidden. And in one particular case, and it happened to be a South Asian family, where the son asked his mother not to have treatment. So she was diagnosed not to get treatment, because then it would be exposed, and his daughter was getting married, and he didn't want it to be made public because it could jeopardize her chances and the family's chances in general. I think the way to, and now we shouldn't be judgmental. I think the best way going forward is to try to make cancer common parlance. So heart disease, for example, is perfectly fine. So why can't cancer be perfectly fine in terms of a disease? So the more we speak about it, I think the more acceptance there will be. So as a family, we should start with our own family, speak about it. And once again, we sexualize things. So speak about breast cancer, speak about prostate cancer in an everyday way. And I think we as mothers, we as grandmothers should lead the way, and just introduce it delicately to begin with. And then perhaps, there's videos that we can play in the family scenario. And so once you break the ice as such, it will become, I think, more acceptable to speak about it. The young generation are far more clued up than you think. They may be embarrassed to speak to us about it, but they're far more clued up. And I think that if we break the ice, they'll come forward to speak about it. And we need to be aware that the young generation is increasingly being diagnosed with diseases at a much earlier age than we were. So we need to speak to them about it.
Yes, absolutely. So, what lifestyle steps? I know you've already spoken about exercise like walking and that, but what lifestyle steps can help reduce?
Yeah. Once again, we women, by nature, we're nurturers. So we come bottom of the heap, as it were, when we're prioritizing things in our lives. So our parents, our children, even our friends come before us. So the analogy that's typically used, and I'm going to use it because we can all relate to it. So when you're on the airplane, don't they say that put the oxygen mask on yourself before you put it on the baby? Because you could go in a millisecond. So the same thing in our lives. If we take care of ourselves and take care of ourselves well, then we can set a good example, but also be healthy enough to stay around for longer to be able to, take care of our family. So 3 pillars to remember is diet. I don't mean to say diet in terms of reducing weight. I meant good, nutritious diet. So try to avoid greasy foods. Steer clear. I'm sure our generation do steer clear of processed foods, but even ready-made sandwiches is processed. So try to steer clear of processed foods. Absolutely, ultra-processed foods should be banned from within our vicinity. Regular exercise. Once again, you can't start running a marathon. I don't suggest a marathon at all, but just go for a walk. Just be active. Even walk around the house. And if you've got a moment to spare, just walk. Go out of your front door, walk around the garden, anything, just for movement. And changes in our lifestyle can't just start suddenly. Small steps. So begin those small steps. And 3rd pillar is self-love. Do things that you enjoy doing. And be kind to yourself. And please don't self-criticize. Just be happy. Happiness is power, I have to say.
You've just answered my last question, which I was going to say for everyone to take away. What would you share? You've just shared that. Thank you again for helping us raise awareness and encouraging these important conversations. Thank you very much. On behalf of GAA London, I would like to sincerely thank our speakers for giving their time, knowledge, and guidance on such an important health topic. We would like to invite Aloma again and talk about furthermore. And today's session has helped us understand the importance of breath awareness, recognizing, attending screening when invited, and most importantly, not delaying in seeking medical advice if we notice any changes. I hope everyone attended today feels more informed, reassured, and confident to have open conversation about breast health with family and friends. A heartfelt thank you all to you all, also to all our participants for joining us this evening and for taking part in the Q&A. Your presence and engagement makes these community health and wellness webinars meaningful and worthwhile. Please do share what you have learned today and with your loved ones, as awareness and early actions can make a real difference. Once again, thank you for our speaker. Thank you to everyone who joined, and thank you to GAA London for helping organize this valuable session. We wish you all good health and well-being. Good evening.
Thank you, Panna.
To continue.
Thank you.
Thank you.
Thank you, Panna. Very interesting.
Very interesting. Thank you.
Good. So like I said, we'll call Aloma for talking about density, how it's all hidden and we don't pick that up. And this is the way we're going to learn from her more. So I don't know if she's available next week. Would you like to continue next week or the week after?
Very good question.
I'm booking you now.
You've put me on the spot, haven't you? Yes. Should we liaise afterwards? But yes, absolutely happy to come back because there's so much to speak about. And I think next time it can be more conversational, rather than speaking full script.
Sure. So we shall see you next week then.
Next
you
week or
very
the week after, I'll check my diary with you after.
Okay, let me know. We shall fix the date. Thank you again. Thank you again. Shubharatri to everybody. Take care.
Thank you.
Thank you.
you. Thank you, Panabin.
You're welcome. You're welcome.